Okay.
Knock, knock. Hello, my name is Micah, and I'm going to be your nurse today. Let me set down my supplies real quick and provide some privacy for you. Can you show me your wrist and state your name and your date of birth?
My name is Dylan Gray. My birthday is January 24th, 2000.
Okay, thank you very much. So we're going to be doing a head-to-toe assessment on you, and it's going to be a full-body head-to-toe assessment, and I'm going to be needing to touch you. Is that okay?
Yes.
Okay, so I'm going to raise the bed in a couple seconds.
I gotta get those germs.
Yep, all the germs.
Oh.
Okay, I'm going to raise the bed a little bit. You just stay laying for a second. Okay, it's at my working height. You can sit up and sit on the side of the bed, but don't get off. Okay, I'm going to be starting by looking at your head. It is normal cephalic, it is bilaterally symmetric, and it is in the shape of an oval. Can I touch you?
Mm-hmm.
Okay, as I touch the scalp, is there any pain or is there any tenderness?
Nope.
Okay, there's no masses, there's no nodes, and there's no lesions, and the scalp is intact. The hair is brown, it is fine, it is smooth. There is no melapattern balding or alopecia. I'm looking at the back of the ear or the nape of the neck, and I see no pediculi, nits, or parasites. Okay, I'm gonna go back to the face. The face is oval, it is symmetric bilaterally, and there's no involuntary muscle movements. Can you do a couple, I'm gonna test cranial nerve 7 for me. Can you raise your eyebrows? Can you wrinkle your forehead? Can you frown? Can you smile with teeth? Smile without teeth? Can you purse your lips? Can you puff your cheeks? And then can you whistle? Okay, patient's cranial nerve 7 is intact. I'm going to be going to his eyebrows now. Looking at the eyebrows, they're evenly distributed, they're bilaterally symmetrical, and they do not hang over the eye. I'm looking at the eyelids. The eyelids are bilaterally symmetrical. The skin tone is consistent with the rest of the face. There is no edema or no swelling. And then I'm looking at the eyelashes. The upper ones curve upward away from the eye. The lower lashes curve downward away from the eye. And then they are evenly distributed. I'm going to look at the sclera now. Pulling down the sclera, it is pink, it is moist, there is no discharge. I'm looking at, that was the conjunctiva. Now I'm going to look at the sclera. The sclera is white, it is clear, the cornea is transparent and smooth, the iris is brown, and it has a brown consistent color throughout. I'm going to grab my pen light now, and I'm going to do a couple tests for me, on you. Can you follow my pen light with me, please? I'm going to be running through some fields of gaze with you. The patient was able to look at, follow smoothly through all the fields of gaze without any nystagmus noted anywhere. I'm going to be now testing the patient's pupillary response. Can you look at the pen light for me, please? Okay, the patient's pupil constricted briskly in response to light. Can you put your hand like this for me, please? Okay, testing consensual response, the opposite light constricted briskly to the other eye's response to light. I'm going to be testing the combination now. Can you look over at this pen light for me? And then the patient's eyes dilated, and then as I move forward, the patient's eyes constricted and converge smoothly on the pen light. Now can you just look forward for me? I'm going to test your corneal light reflex. Okay, there was a symmetric, the corneal reflex was present and it was symmetric bilaterally. Okay. Thank you. So I'm going to now be palpating your ears. Is there any pain or tenderness?
No.
Okay, and I feel no masses, no nodules, and no lesions. Is there any pain or tenderness as I palpate your trachea?
No.
Tragus? No. Okay. And also, is there any pain or tenderness on palpation of your mastoid?
No.
No pain or tenderness. Okay, I'm going to step behind you, and I'm going to ask you to cover your left ear with your hand, and then I'm going to ask you to repeat the word I say. Pirate.
Pirate.
Okay, the patient was able to correctly say a two-syllable word for me being 2 feet away, which is a negative whisper test, and there's no sign of bilateral hearing loss. Okay, I'm going to be now going and inspecting the external ear canal. I'm going to be pulling upward and back of the pinna. As I go in, I see the ear canal. It is pink. There is serum, which is consistent in color for the patient's ethnicity. There's no discharge. There is no lesions. And I see the tympanic membrane, which is a translucent pearly gray color, and it has a conal light at about 5 o'clock. So I'm going to pull out. Okay, I'm going to be looking at the patient's nose now, which is midline and is symmetric. As I touch it, is there any pain or is there any tenderness?
No.
No pain or tenderness. Okay, there's no masses, there's no nodes, and there's no lesions. As I'm looking, the nasals are not flaring. Can you look up for me? As you look up, I see no deviation of the septum. There's no perforations. There's no discharge. And as I go down to the lips now, the lips are pink and they are moist. They are there are symmetric vertically and horizontally, and there is no cuts or there's no crusting. Can you open your mouth for me, please? I'm going to now go to and open up my sterile tongue thing. And I'm going to be, can you stick out your tongue for me, please? Okay, I'm looking, and the oral mucosa is pink. I'm looking at the tonsils, are a grade of 1+. Can you say ah for me?
Ah.
Okay, I've touched cranial nerve 10, and the patient's uvula retracted upward with the soft patellate. Okay, I'm going to, can you stick out your tongue for me, please? And can you lift up for me towards your nose, down for me towards your chin, side to side? Okay, thank you. The patient has full range of motion of his tongue. I am now going to be assessing the patient's range of motion of his neck. Could you go back for me, please? Can you go forward for me, please? Can you go touch your left ear to your left shoulder, and then your right ear to your right shoulder, and then can you look left as far as you can, look right as far as you can? The patient has full range of motion of his neck and is able to do it smoothly without any pain. I'm going to test your cranial nerve 11 now. Can you shrug, can you shrug up against resistance? Can you turn your head against resistance? Okay, the patient has 5 out of 5 strength with no muscle weakness unilaterally or bilaterally. Okay, can I look at your hands? Looking at your hand, the skin color is consistent with the rest of the body. The nail bed is pink. The nail is smooth. Can you go like this for me? The angle is less than 160 degrees. I see a diamond, and there's no sign of clubbing. Can I see your hand again? I'm going to check for a turgor. Okay, there was no tenting. The skin is elastic. I'm going to check the capillary refill, which was less than 2 seconds. Can I see both of your arms for me? I'm going to be checking your radial pulses, and they are bilaterally symmetric with a grade of 2+ with a regular and smooth rhythm. And as I checked the radial pulses, I was also looking at respirations, which had a rate of 16 with a regular rhythm and normal depth with no use of accessory muscles. The patient did not have pursed lips and was not in a tripod position. So I'm going to go over some hand motions now. Can you touch your nose with each finger in a rapid motion like this? Okay, could you touch each finger to your thumb in a rapid rotating motion like this? Okay, could you go like this with your hands on your legs for me? And then can you also touch your finger to your nose, and then with your finger touch my finger back and forth as I move it? Okay, the patient has fine motor coordination, is able to perform the functions smoothly without any hesitancy. Okay, I'm going to be testing the range of motion of your arms now. Can you go like this for me? Can you go like this for me? Pull in again. Okay, can you put your arms straight out like this? Can you make a box using your wrists? Try to close the box as far as you can. Try to open the box, and then try to open the box as far as you can. Okay, make the box again, or sorry, just pose your arms like this. Make the box with your fingers. Close the box with your fingers, open the box with your fingers, and extend the box and open it as far as you can with your fingers. And then can you go like this with your hands, rotate them up and down. Then can you spread them apart? The patient has full range of motion of his arms, his fingers, and his wrists, and able to do them smoothly without any pain. I'm going to test the strength in your arms now. Can I see your right arm, please? Can you pull towards yourself? Can you push towards me? Okay, can you push up with your wrist? Then can you push down with your wrist? And then can you open your hands against resistance? And then can you squeeze my fingers? Okay, the patient shows 5 out of 5 strength bilaterally with his arms, his wrists, and his fingers, and there's no unilateral or bilateral muscle weakness noted. Okay, I'm going to now go to your posterior or your back, and looking at the patient's back, it is bilaterally symmetric. The scapula is bilaterally symmetric with equal muscle development. The spine is midline, and the skin tone is consistent throughout. The patient's side to side length is twice as long. It says front to back in a 1:2 ratio. I'm going to ask the patient to cross his arm. Can you cross your arms in front of you a little bit, just to open up your scapula from your spine? So I'm going to be asking you to breathe in and breathe out, and I ask you to. Can you breathe in and breathe out for me? Can you breathe in and breathe out? 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 There was no advantageous lung sounds on the on the posterior upper thorax or the posterior lower thorax. They were both clear. and there was no evidence of bronchi, wheezing, or a pleural friction rub. Can you cross your arms once again in front of you? And I'm going to be auscultating your lateral thorax. Can you breathe in and breathe out, please, when I ask you to? Could you breathe in and breathe out? 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 Okay, on auscultation of the patient's lateral thorax, it was clear and there was no adventitious lung sound, such as the pleural friction rub or wheezing or bronchi. I'm going to go to the patient's anterior thorax now, and as I'm looking at it, it's symmetric bilaterally. There is equal muscle development. The skin is consistent with the rest of the body. I'm going to ask you to breathe in and breathe out, please, when I ask you to. Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Can you breathe in and breathe out for me? Okay, the patient's anterior upper thorax and anterior lower thorax was clear. There was no adventitious lung sounds such as wheezing, a pleural friction rub, or any bronchi. Okay, and I already assessed the respirations, so I'm going to actually now go to cardiac. So as I'm looking, I see no visible pulsations, and as I'm palpating, I feel no heaves and I feel no lifts. I'm going to be now auscultating with the diaphragm first some of your cardiac landmarks, then I will later switch to the bell. So I'm going to be auscultating the right sternal border, second intercostal space over the aortic, and I hear S2 louder than S1. I'm going over to the left sternal border, second intercostal space over the pulmonic, and I hear S2 louder than S1. I'm going into the left sternal border, third intercostal space over Erb's point, and I hear no murmurs. I'm going over to your left sternal border, fourth intercostal space over the tricuspid, and I hear S1 louder than S2. Then I'm going over to your fifth intercostal space, mid-clavicular line over your mitral, and I hear S1 louder than S2, and I heard no S3, S4, or any splitting. I'm now going to be switching to the bell of my stethoscope and going over the points again. I'm going over the aortic point, and I hear S2 louder than S1, and I hear no S3 or S4. I'm going over the pulmonic, and I hear S2 louder than S1 with no S3 or S4. I'm going over to your Erb's point, and I hear no murmurs. I'm going over to your tricuspid, and I hear S1 louder than S2. And I'm going over to your mitral, and I hear S1 louder than S2, and I heard no murmurs. I heard no S3 or S4, and I heard no splitting through any of the points. Okay, I'm going to now ask you to lay down for me, please. So I'm going to be inspecting the patient's abdomen, and as I'm looking at it, it has a flat, smooth contour, and I see no dilated venous patterns, masses, or lesions on the abdomen. I'm going to start auscultating on the right lower quadrant and then working my way around with using the diaphragm. I'm switching back to it. Starting the right lower, then I'm going over to the right upper, then I'm going to the left upper, then the left lower, and every 5 to 30 seconds I was able to hear high-pitched gurgling noises. There's no evidence of Borg-Varigny. I'm going to be now percussing the patient's abdomen. I'm starting at the right lower quadrant. I'm percussing 4 points in the right upper quadrant because of the liver, and 3 points in every other point. I heard tympany throughout except the dullness on the right upper quadrant over the liver margin. I'm going to be now palpating. Is there any pain or tenderness on palpation?
No.
Okay, there's patient reports no pain or tenderness on palpation. And as I'm palpating all the quadrants, I am not feeling any masses or nodes or lesions on the patient's abdomen. Okay, I'm going to actually lower the bed now. And as I'm rolling into bed, can you sit up for me and dangle your leg off the side of the bed, but please don't stand up. Okay, I'm looking at the patient's legs now. The hair is evenly distributed. There is no varicose veins or dilated veins that I can see. The skin color on the feet is consistent with the rest of the body. I'm looking at the nail bed. The nail bed is pink and the nail is smooth. I'm going to now test the capillary refill. Capillary refill is less than 2 seconds. I'm now going to be taking your pedal pulses, your dorsalis pedis pulses, which are bilaterally symmetrically smooth with a regular rhythm. And then I'm going to be now taking your posterior tibial pulses, which are symmetrically bilateral with a regular and smooth rhythm. Okay, I'm now going to be testing your deep tendon reflex with my reflex hammer on your patellar tendon. Okay, the patient had a 2+ patellar tendon reflex. Now I'm going to ask you to do some range of motion tests with your legs or fine motor coordination tests. So can you just tap your leg real quick on the ground for me? Can you run to the back of your foot on your opposite shin for me? And then can you make a figure 8 for me in the air with one of your legs for me? Okay, the patient shows fine motor coordination, is able to do the motions smoothly without any hesitancy. Okay, I'm actually going to ask the patient to stand up for me now. The bed was lowered. Can you look this way and then can you bend down for me, please? Okay, looking at the patient's back, the shoulder height is equal in height bilaterally, as well as the patient's hips. The spine is midline. There is no evidence of scoliosis, kyphosis, or lordosis. You can stand up for me. And can you just bend down again for me, and then can you just bend down for me again, and then can you lean back for me again? Can you lean side to side with me? And then can you rotate left and right for me? Okay, the patient shows full range of motion with his spine, and he was able to do it smoothly, and there was no spasming or pain. Okay, could you walk to the wall normally and then walk heel to toe back for me, please? Okay, the patient had a smooth, symmetric gait with opposing arm swing. Okay, now could you stand on one leg for me? And then could you close your eyes for me? Then you can open your eyes. And then can you just jump up and down with me a couple times? Okay, and then can you put your legs together, arms together, and then just close your eyes for me? Okay, the patient has you can open your eyes. The patient has a negative Bromberg's test. The patient's gait was smooth, it was symmetric with opposing arm swing. The patient had good balance and with fine cerebellar and proprioception with a negative Bromberg's test. You can sit down for me, please. So that concludes our head to toe assessment. Your call light is right here, your bed is lowered, your rails are up, and I'm going to collect my tools. I'm going to do hand hygiene, and then you have a wonderful day.